Here we are going over the details and tasks and pieces of information you're going to need to answer questions that are collected in Domain 5 covered by the HCISPP exam. This group of information details has to do with information risk assessment. Let's get started. Most of you are familiar, I would believe, about identity theft. It's been around for many, many years. But what's interesting is that as honest and regular people, you might not realize that medical identities are actually worth so much more on the street between criminals than identity theft. So here is an exact example. The street value of a stolen Social Security number is $1 for a Social Security number. But the street value for stolen medical identity is $50. That is a tremendous higher rate of return for stealing the data that we are responsible for protecting. They not only use it for fraudulent billing, but they also use it, the criminals that is, that buy this stolen medical identity, they also use it for obtaining free medical care because they can now go to the doctor and pretend that they're someone else with somebody else's policy number and somebody else's coverage. And the way things have been, it takes a long time for this theft to be discovered by the beneficiary or the individual whose medical identity has been stolen. But we're going to change that. So one of the first things that we've done, and we have talked about this in the previous domains, is preparing to do a risk assessment. First, we have to all be very clear as to what this entails. This is the process of identifying information security vulnerabilities, estimating how valuable those vulnerabilities are or what that risk is, and then prioritizing them. So, because we can't do everything all at once, despite what some people think, okay? So, therefore, we have to do the assessment, identify the problem areas or the vulnerabilities, estimate the value of risk, and if you remember, we discussed this in Domain 4, is determining high level, low level, medium level of risk, and then prioritizing them so we can act upon mitigating or mediating the highest risk items as quickly as possible, and then make our way through the rest of the list. And yes, there's going to be a list because nothing is perfect. And then when you're done with that, you have to start all over again. Okay. All right, so I know that we also talked about this in Domain 4. So to reiterate and to restate that we're going to use TVLI, and if you remember, we had that formula in Domain 4 for this, is risk equals threats times vulnerabilities times likelihood times impact. So by now, these terms and what they mean with regard to risk assessment should be familiar to you, and you should be comfortable in answering questions regarding what they mean and how they fit into what we do. So now we're going to look at the way that they fit into the life cycle of not only technology, but this whole responsibility that we have of securing and protecting the privacy of this information. So as we have discussed, you have to determine the impact of the information on the organizational mission, as well as the departments and, of course, the patients. We also need to look at determining the cost of replacing that information, if it can even be replaced. Okay, and one of the great analogies I think that there are with regard to replacing information, because sometimes it's hard to fathom, is if you go back to Hurricane Katrina and the impact it had on hospitals and doctors' offices that were keeping paper records. And that information was lost. So if you can imagine the cost of having physicians' offices and all of their staff trying to contact their patients. Now, of course, contact lists were on paper as well, so all of that is gone. Trying to remember who the patients are, how to contact them, and what, if at all possible, to try and reconstruct a lifetime of healthcare diagnoses and procedures. Forget about trying to ask a 50-year-old how old exactly were they when they got their MMR and any other vaccines that happened in early childhood. Everything is gone. I had a similar issue with my parents. With those people who immigrated from other countries, you are walking across Europe or across countries to get to a safe place. You don't carry your medical records with you, if they even had records. And the same thing is true nowadays when you look at the refugees coming from Syria. Their homes, their communities, their everything have been bombed to smithereens. They get to get out with their lives, and they're lucky if they can bring a change of clothing. They're not bringing their medical records. So think about what it would take to replace this information if it's at all possible. We also need to look at who has a need for the information and when. So this might be a primary priority, I should say. The priority certainly would be those patients who are under care currently, who have current concerns that need attention right away and ongoing attention from the healthcare provider. And we can deal with current issues and then as possible, fill in past histories. But again, look at the people hours. We used to call them man hours, but look at the people hours, the number of people, the number of hours that it would take to reconstruct all of the data that we house. Wow. So yes, we better darn well keep this information safe and backed up and protected. And then, of course, our fourth bullet, which is we also need to identify anything that's inaccurate, because inaccurate data is as bad, is maybe worse than no data at all, and anything that we can go ahead and destroy. That does not become such a pressing issue with electronics because, information that used to take an entire room filled with 5-drawer filing cabinets can now fit on one CD-ROM. So the space issue is no longer as much of an issue, but we still have to be aware of things that can be set for destruction and how they are destructed. Okay. We also have to remember that our jobs are cyclical and never end. Oh, that's good. Job security. Okay. So as soon as you finish that risk assessment and you start working on the prioritizing, the mitigation, the closing of the vulnerabilities, you're ready to start again with a new assessment because things change and things happen and we always have work to do. So the risk analysis should be ongoing and at the very least cyclical. And this needs to happen again, even out of a plan, whenever anything is updated. There is a new update for your operating system, or there's a new update of codes, or there's a new update of software, or there's a change in policies and procedures, or whatever. We have to be right there on the front lines in analyzing, changing, correcting, protecting. Now, the risk assessment process as identified by NIST, and you should be familiar with that abbreviation. If not, get familiar with it. You don't have to know everything about it. You just have to know who they are and understand that that is an abbreviation for an accrediting and overseeing body, okay? And they break down the risk assessment process into these 8 steps. Characterization of the system, vulnerability identification, threat identification, countermeasure identification, likelihood determination, impact determination, additional countermeasures recommendation, and then we have to document what we did, all of those. Not only identification, but then what did you do about it? Remember, it's not enough to say, oh, look, there's a hole in this wall. You then need to patch it. And then you need to document that you identified the hole and you patched it. All right, what is the desired outcome? This is very straightforward. We need to identify these threats, the vulnerabilities, and then we need to do something about it. And remember, the action part is as important as the identification part. They go hand in hand, because if you don't know what to do, if you don't know what action to take, then you just identify a vulnerability and the hole stays in the wall. And then you can't know what action to take if you don't know that there is a hole in the wall. I mean, were you going to go to Home Depot and say, I don't know why I'm here. I don't know what I need to do. I don't know. No. You have to say, oh, look, there's a hole in my wall. Please share with me the best ways to patch this. Fix this. Keep the boogeyman out. Internal and external audits. And these are very important because internally, when you work for this company, you need to be focused on keeping it safe. You are a member of the team, you know the people, and this can actually work a little against you because you may not be totally objective. Okay, you may know the person who did the coding that didn't do it accurately, and therefore you might be hesitant to identify the vulnerability. Or you might assign one of your team members to install a patch, and they didn't do it properly, or they didn't use the most updated version. Okay, so we're people as well as we are professionals. And that's exactly why we can sometimes look to have external audits, because they have the objective viewpoint and they have a job to do. And when we work together, both internally and externally, we can get the best results. And remember, that is what is going to be your job security. Job security is not made of or constructed for employees who never make a mistake. Job security is constructed of individuals who are willing to say, oh, I made a mistake, here's how I'm going to fix it. That is the most important thing, is being honest and taking action to abate the negative results. If you wait until everything is stolen, it's too late. So the honorable thing is to find your own mistakes as soon as possible. If you do it soon enough, nobody will ever know you made the mistake. But then if this mistake comes to light, you need to own up to it and fix it. And that's job security. Okay. Identifying control assessment procedures are very important. And here we have 5 that you need to be aware of and understand their role in what we do. Consistency, measurability, standardization, comprehensiveness, and modularity, because we need all of these things to keep us moving in the right direction and keep us protected. So become familiar with what these control assessment procedures do, what their function is, so you can identify them and how to use them. Information gathering. Oh, I always feel like a little like Red Robin Hood. I'm going to take my little basket, and instead of gathering nuts and fruits from the forest, I'm going to gather information relative and relevant to a risk assessment. Be on the lookout. Awareness, alertness to understand everything that has to be covered and cover it and look at it, investigate it. This is not about laying blame. This is about identifying vulnerabilities and fixing them. So we look at threat determination. We've talked about it. We talked about threats last week with Domain 4. And look at all these various different types of threats that are very real. And honestly, they're in the news on a regular basis. Look at human, malicious insider or outsider sabotage. We had that not too long ago with the WannaCry. Ransomware. Okay, natural disasters, hurricanes, fire, tornado, floods. We have no control, but we do know that they happen. And we do know that they are going to occur. So therefore, plan now to lessen the threat or avoid the threat altogether. Technical, hardware, software failure, malware, viruses, that's easy. Those are easy threats for us to deal with because we can test hardware and software on a regular basis and make sure that we look for any vulnerabilities or any failures. We can make sure our virus protectors are up to date. This is absolute. Faulty components and security defense failure as physical threats. You need to know what they are, and you need to be a stickler for these. And you need to find out if it's going to fail. And if it's going to fail, you need to mitigate that failure. Environmental, hazardous waste, power failures. This happens. Okay? What are you going to do about it? And operational, okay? And remember again, this is not the CIA as in the spy agency. This is confidentiality, integrity, and availability. Absolutely. Absolutely. Now, remember that it is not only your job to identify these things, prepare for these things, have that plan, have that backup system, whatever it is, but also remember that saying, well, the president of the hospital or the physician who owns this clinic will not provide the support, financial support or manpower support that we need to mitigate this, okay? Well, first of all, it's your job to help them see reality. And if that really, really, really cannot be done, then you need to document that as well. That is what we know as CYAWP. Cover your with paper. Likelihood determination is it's a little bit vague when you're trying to predict. So what is the likelihood that a hurricane is going to come to town and actually strike our hospital or our clinic? Well, you know, the National Weather Service has a challenge with that, but they are an excellent source for you to base upon your likelihood regarding natural disasters. So what I mean by that is there is support. This is not all on you to sit in your office and saying, so how likely is it that if such and such a person is fired, they will come back and sabotage the system? Okay? You don't have to do this alone, all right? And then there are things that are easier to cover than not. So you You need to make sure that all of those people with authority to fire any staff member in the building must notify you or your office when the decision is made to fire them before the individual is notified that they're fired, so that you can cut off their access into the computer system before they have a reason to be revengeful. Okay? So that's what we're talking about with regard to likelihood. Is you don't have to worry about the likelihood of a fired staff member coming to sabotage when your plan is to prevent anyone from sabotaging. Okay? Gap analysis, very important for you to understand what is real right now, what needs to be done, and how big is that space between. Okay? Now, you have to be realistic, and we have talked about this in previous weeks, that there are going to be some vulnerabilities and some threats for which you cannot prepare fully. Okay, you do the best you can to mitigate, you do the best you can to limit, and then you make sure that you're prepared with a plan for the what happens when. Not if, but when. And this is part of your responsibility, because you are the one, you and your team are the one who can recognize those security effectiveness pockets and those pockets that are not so effective. You know what strength and what weakness is in this arena. The CAP, the CAP Corrective Action Plan. And remember, I mentioned this before. Action. You must take action. That's the only thing that really works, is not to sit and say, yeah, well, I told them there was a hole in that wall and they just decided not to do anything. You are the one who has to prompt the action, okay? And you need to have that plan. You need to talk to people and engage an action plan as if they don't know. They cannot figure it out. They do not know what you know, which is why you have that job and they don't. So you need to educate them and tell them what to do, and then make sure that they understand what they need to do, when they need to do it by, and then you need to make sure that you review what they did to make sure that they did it correctly. Okay? Somebody's got to be responsible. You can delegate that responsibility to someone else. That's good leadership. However, you also need to know that you are always ultimately responsible. I know. Mitigation actions. This is what I was talking about before, is sometimes you can get rid of a vulnerability altogether. Sometimes you can only lessen the vulnerability, but there are things that you can do and there are things that you must implement. You need to become familiar with all of these different mitigation actions, and you need to understand how they fit into the whole entire CAP plan. And wait, this is not the only slide. We have more. And we need to make sure that all of these things are considerations as you create your CAP plan and you look to put it into action. And again, there is a great benefit to using your team. Again, this is not all on your head. You have other people that know things that you don't know, or maybe they know different things. Maybe they have a different perspective. Use your team to create a mitigation action plan that will be the most successful. And more, okay, we want to make sure that it's being covered from top to bottom. And this is absolutely important because we are the front line of this defense. All right, The controls that are listed here, administrative, operational, physical, and technical, you will notice align directly with the safeguards identified by HIPAA's security rule. Use the summary of HIPAA's security rule safeguards to give you an in-depth knowledge and understanding of these three types of controls. And we have controls related to time because we have to do things in a rapid manner because that's the nature of healthcare. Identify, protect, detect, respond, recovery. That is the NIST framework for controls related to time. Become familiar. And then we have the HCISPP controls related to time: protective controls, detective controls, responsive controls, and recovery controls. Become familiar. Understand when we say preventive controls, what does that mean? That's how you want to prepare for this exam. Okay, if you have a question related to Domain 5 content, you know that others have the same question. So come on into the discussion and share what you're thinking, what your questions are, what your concerns are, and we'll work together to help you.